Hey everybody, we'll talk today about medications used to treat psychotic disorders. Psychosis is a symptom that is characterized, according to Halter, by altered cognition, altered perception, and an inability to determine what is real and what is not. It is a symptom that can accompany a variety of disorders. For example, the mania of bipolar disorder, severe depression, street drug use, alcohol withdrawal, brain neoplasm, and metabolic disorders. Psychoaffective disorders can be described as a combination of psychotic and mood alterations, and these clients can experience psychosis as well. Schizophrenia affects about 1 to 2% of the population. Clients with schizophrenia exhibit at least one of the psychotic symptoms we will talk about soon. These symptoms interfere with functioning at home, work, school, or in social situations. I'd like to bring up the point that the World Health Organization has found caregiver strain when caring for a family member with schizophrenia is comparable to caring for a person with quadriplegia. Family functioning is greatly impacted by this disease. On the next slide, we'll watch a video. Make note of the symptoms that the person is experiencing. On the slide after that, we can talk about the symptoms and some of the terms used to describe them.
You are about to experience a brief simulation of a psychotic episode in a patient with schizophrenia. Schizophrenia can provide powerful experiences, especially for those undiagnosed or not being treated effectively enough. The symptoms you will experience represent a compilation of a range of sensory occurrences, as reported by actual patients. These occurrences include sights, sounds, as well as wind and even scents. If you have any discomfort during the experience, please signal a facilitator.
Worthless.
He's waking up now.
Oh, the phone woke him up. Don't answer.
They'll know who you are.
You're a waste of
Why are you
space.
so stupid?
A waste of our time.
Stupid. So stupid. Worthless. We hate you.
He's gonna pick up the phone.
They'll know if you lie.
Rain! It's
Something
rain.
wrong. Weather.
Now to get pizza.
Poison.
Coming for you. Pizza.
He's hanging up.
Do you hear me?
Don't eat.
Out to get you.
Poison.
They know about you.
Cameras
Poison.
were rolling when the armed gunmen entered the convenience store on 14th Street. The suspects were described as medium in stature with a slightly youthful demeanor. Anyone with information about this incident is urged to contact
They know.
They know about you.
And in other news, officials have closed the northbound
Time for
lane
meds.
Don't do
Boulevard
that.
due to a water main break. Repair crews are on the scene. Now here's a story out of Chicago from last night. Two men posing as maintenance workers nearly made it out of the Quick Bite convenience store with the store's ATM machine.
Make a
The
list.
suspects
Make a
pulled up in
longer
van,
list.
entered the store, asked for
You
customers to
are
not use the
ungrateful.
machine because of
You're a
reported
waste of
problems.
space.
They
A
told
waste
the
of our
clerk that they were
time.
going to take the machine back to their
Getting
shop and
coffee
repair
now.
it.
Don't drink it.
Sensing something
Stupid.
suspicious,
So
the clerk
stupid.
That
called
smells
local
awful.
authorities.
Don't drink that coffee.
When the clerk told the men he had called police, the pair took off and left left the machine.
Why are you so worthless?
So, Sky, tell us how this weekend's weather is shaping
Weather.
out.
Something wrong.
You know what, Chuck? There's just no stopping the weekend weather. You hear that, worthless? Weather's coming to get you.
Something wrong. Weather.
And what are you going to do about it, huh?
Something wrong. You have to stop it.
You're just going to sit around with your stupid mouth open and do nothing?
You have to stop it. It's the weather. It's here for
Now
us.
he has to answer the door.
It's here for us. Do something. Stay in. Stay away from the
No,
door.
stop the weather. Protect us.
You didn't order anything. No, don't answer. You're stupid to open that door. He has to open the door now.
Here you go.
Don't do
You'll
it.
be in trouble. Poison.
This is for you.
This is for you. He's working with them. He's part of the plot. This is for you. Shut the door. Shut it. Don't eat it. Poison. You're stupid to open it. I hate you. We
Here are
hate
some
you.
items on today's activities calendar. And you need some activities, especially when you're lazy and you sleep too much. Stop staring at me.
I know what you're thinking.
He knows. You can stop
They're
him.
coming for you. You know that.
Part of the plot. Use your mind.
It's because you're so ungrateful.
Don't eat it. Poison.
No. Don't open
He
it.
has to open the box.
This is entirely your fault.
Don't eat it. Don't eat it. Poison. Poison.
They're here, and it's all your fault.
Oh.
No.
They know it's you. You're in
Don't
control.
open the door.
You hear that?
No. Don't open it. Don't open it.
They're here, and it's all your fault.
You did it.
You should have used your mind to stop it.
Stop it. You have to take control.
Stop the door.
Hey, you all right in here? I called you. Why didn't you answer? I was like screaming, "It's Lorraine! It's Lorraine!" into the phone at the top of my lungs.
What were you watching? Do you even remember?
Did the pizza Oh, what happened here? Did you forget to take your medicine this morning? Well, you know it's not good to miss a dose. Well, it's not too late to take it now. Let's get back on track. And why are you standing here in the dark? It's a beautiful day outside. Let some sunlight in. You need to get outside and enjoy it.
This experience is intended to heighten your awareness of the conditions affecting breakthrough symptoms in patients with schizophrenia, who may be in need of efficacious treatments. It is not meant to suggest that all of the symptoms depicted here are displayed by all schizophrenics. There is no typical case of schizophrenia.
Some of the signs and symptoms of psychosis include delusions, thoughts and beliefs that have no evidence, not founded in reality. The thoughts may involve persecution. For example, the subject of this video thought the delivery man was eyeing him suspiciously. There were thoughts of, "They're out to get you." Other delusions can have religious or grandiose themes. Hallucinations, perceiving an internal or external stimulus where it doesn't exist. They can be visual, like the headline or a newspaper that suddenly changes. They can be auditory, like a newscaster telling you that you're worthless, or voices telling you not to open a door. The hallucinations could also be tactile, like feeling bugs are crawling all over you, or olfactory, like you're smelling something that isn't really there. People experience psychosis may exhibit a lack of insight and not undergo the usual reality testing that most people do. Thoughts can be disorganized, and the ability to problem solve can be impaired. Mood and affect, which is the way we express emotion, may be incongruent. One might laugh at sad news. Facial expressions could be blunted or severely limited in expressing that emotion. Symptoms are thought to be either positive, which would be more than the normal functions that we experience, and these would include delusions and the hallucinations, or symptoms could be negative, which would be absence of action that should be there, isolating, which is the case of the subject of this video, whose friend had to tell him, get outside, get out of doors. Also, there can be a lack of performing activities of daily living. That would be another negative symptom. There are a few possible explanations for the pathophysiology of schizophrenia. A widely accepted explanation points to a neurotransmitter imbalance involving dopamine and serotonin. Increased activity of dopamine and serotonin in parts of the brain that affect cognition, emotion, and motor function. There's a strong evidence here that schizophrenia is inherited. If a first-degree relative has schizophrenia, a family member is 5 to 10 times more likely to develop it than members of the general population. Environmental factors can play a part too. Sexual abuse in childhood, psychological trauma, poverty, toxins, and developmental stressors can all contribute to the development of schizophrenia. Antipsychotics are the medication of choice used to treat psychotic disorders. They block dopamine and or serotonin receptors. They have a calming effect, but they do not affect spinal reflexes. Antipsychotics mechanism of action can either be to block the dopamine receptors or both dopamine and receptor in the limbic system of the brain. By blocking these receptor sites, they interfere with the stimulus that lead to the altered perceptions and changes in motor activity. Antipsychotics are medications that do affect the central nervous system. The target cells, though, are located in the brain. What sets them apart is that they do demonstrate what is called a degree of indifference. They can block the stressful stimuli, but they don't interfere with spinal reflexes or pain. Remember from nursing 1, reflex activity like the patellar reflex, the gag reflex, and pain are parts of the body's defense mechanisms to prevent injury. Antipsychotics are sedative hypnotics. They induce calmness at low doses and sleep at higher doses. Higher doses may be given during emergency situations, lower doses as part of maintenance therapy. A treatment of schizophrenia involves helping the client through the acute phase by ensuring their safety, helping them to meet their needs, and relieving the symptoms. Then, once they're stabilized, maintaining the patient through adherence to pharmacotherapy, receiving ongoing counseling, and attending support groups. RNs play a major part by providing emotional support along with disease and medication education. Medications are categorized as either first generation or traditional. Now, these block the dopamine 2 receptors, and they're mainly effective on positive symptoms. They also tend to have more side effects than the second generation, or atypical antipsychotics, which block both D2 and serotonin receptors. Atypical antipsychotics tend to be more expensive, provide less sedation, and they tend to be effective on both positive and negative symptoms. First generation or typical antipsychotics have been used since the 1950s. These would include chlorpromazine, brand name Thorazine, and haloperidol, brand name Haldol. As mentioned before, they block dopamine 2 receptors in the limbic system, but not the serotonin receptors. Some of the features. First generation antipsychotics are less expensive. They are effective in controlling the positive symptoms, but not as effective in treating negative symptoms. In emergency situations or in treating severe psychosis, they are given in higher doses, often intramuscularly, along with lorazepam or Ativan, which treats the anxiety associated with psychosis. Lower doses are given for maintenance therapy. The meds can come in liquid and tablet form. There is also a decanoate or slow-acting form for haloperidol and flufenazine, given IM. The first generation decanoates are prepared in a sesame oil-based solution. So abscess formation at the injection site is possible. An important point here. Not all of the symptoms of psychosis may disappear with the use of antipsychotics. An English research study stated that about 25% of clients reported that all symptoms disappeared. Ongoing counseling and support are essential for treatment. First generation antipsychotics tend to have some significant side effects. These may interfere with medication adherence. In fact, 60 to 80% of clients taking antipsychotics can relapse. Now, extrapyramidal effects can occur, and these would include akathisia, very common of the extrapyramidal adverse effects. This is an inability to rest or relax. Clients have reported to me that they feel like they are jumping out of their skin. Pacing and insomnia occur with akathisia. Dystonias, involuntary muscle movements involving spasm of the facial, back, and tongue muscles. Drug-induced Parkinsonism. Remember from our discussion of Parkinson's disease that as part of the disease process, there is an imbalance where dopaminergic effects are inhibited, and that leads to the tremors, muscle rigidity, and alterations in gait that are characteristic of Parkinson's. Because first generation antipsychotics block dopaminergic activity, they can cause Parkinson's-like side effects. These are often treated with a medication called benztropine or cogentin. Tardive dyskinesia, or TD, can occur with long-term use. TD manifests as unusual facial and tongue movements. If caught early, the medication can be stopped or dosage reduced, and the condition reverses. Let's watch this video so we can observe some of the symptoms of TD and listen to how this gentleman, Jeff, copes with the disease and the side effects.
My name is Jeff. I live in Northeast Philadelphia. I was diagnosed with schizophrenia when I was 17 years old. I had a rough time growing up. There was a lot of difficult situations that I had to endure. Didn't have any friends at that time. Felt hopeless. But once I had my first breakdown, I was hospitalized then, right before I graduated high school. I stayed home basically that whole 1970s. That was a whole decade that was unproductive, and if I continued to do that, I would wake up one day, an old man, and not have felt like I accomplished anything. I was seeing a psychiatrist, and he encouraged me to enroll into a mental health program. The program was very big on building social skills, making friends, and being part of society as a whole. And that was important because that made me build up my self-confidence. Over the years, I was on a lot of antipsychotic medications until I tried one particular psychiatric medication that soon after I started taking it, I felt the best I did since I was a little boy. I had no self-consciousness being out in public on this medication. When my psychiatrist warned me that I would develop physical symptoms in several years in the future, I wasn't really concerned about it because I was doing so well. I didn't want to have the risk of giving that up. Several years later, I woke up one morning and I noticed that my cheeks were puffing in and out uncontrollably. And I was horrified when I saw my image in the mirror. And then the puffing in and out changed to grimacing. And I wasn't surprised that I was diagnosed with tardive dyskinesia, TD, because I knew grimacing was one of the symptoms. But I was surprised. I started to have other physical problems that I wasn't prepared for. TD has had a big impact on my life. My symptoms of TD are very visible, and as a result, people look at me differently. I travel by public transportation, and I have kids turn around and stare at me because they're curious or they don't understand why this man's making faces. So I don't get upset about that, but it does upset me. When people see me grimacing, they come to the conclusion that there's something wrong with me. I also dealt with discrimination. Several times when I went with a friend into a restaurant, the hostess or the host escorts me to this more dining room, and they do that to keep me away from most of the patrons. I'm very saddened that there's people who have TD, and because of their movements, they're embarrassed to be around other people. Over the years, I worked with my doctors to treat my TD, but nothing really worked effectively. I think doctors could be more helpful with their patients by addressing the social stigma that TD patients have to endure, and finding steps where they can help their patients feel comfortable in the community. I've been very fortunate to be in the community. I like being on committees, seeing the same people every time, and you have a connection with them. Also, I'm very active at my church. I teach Sunday school to the adults. I've been making presentations for years, and I think which is most rewarding is they see that I have challenges like schizophrenia and tardive dyskinesia, And they see all that I'm able to do despite these disorders. If I can do it, then other people can do it as well. I believe I can make a difference. Thank you very much. My name is Jeff, and I'm honored to share my story.
Neuroleptic malignant syndrome is a rare but dangerous, potentially fatal adverse effect. It is characterized by high fever, tachycardia, blood pressure changes, muscle rigidity, and dyspnea. If untreated, coma and then death will happen. It is a medical emergency. Treatment involves stopping the medication first, then administering IV fluids, antipyretics, and muscle relaxants. Anticholinergic side effects are very common with antipsychotics. We've talked about them before. We're going to talk about them again because they do occur with a range of different classes of medications. A picture is worth 1,000 words. So instead of talking, I'm going to be quiet, just let you simply refresh your memory by looking at the slide. Second generation antipsychotics have less extrapyramidal side effects. We think it's because this class of medication targets D2 and serotonin sites in the brain. They're also more effective at controlling positive and negative psychotic symptoms. There is less likelihood of anticholinergic effects. There is a greater incidence, however, of metabolic and immune changes. Metabolic syndrome, a precursor to diabetes, can occur. This is characterized by weight gain, hypertension, and elevated triglycerides. Clozapine, or Clozaril, is usually used if other meds are ineffective. It is a second generation antipsychotic. Our biggest concern is with infection, since it can suppress the bone marrow and cause neutropenia. Neutrophils are monitored weekly for the first 6 months. If they are normal, then they're monitored every other week for 6 months, and then monthly. When the medication is prescribed, the client is registered in a national database where the numbers of neutropenic occurrences can be monitored. So, what can you tell your clients about safely and effectively taking their antipsychotic medication? First, like other medications that affect the central nervous system, it could take several weeks to take full effect. Assess your client's behavior, mood, thoughts, and affect. Are verbal responses becoming more logical? Are mood and affect congruent? This could give you a clue as to whether your client is adhering to medication therapy. Teach your client about some of the adverse effects associated with antipsychotics. Have them call the provider if a fever is present. It could be an infection due to neutropenic effects. Also, call the provider if there is fever, dyspnea, and muscle rigidity. This could be neuroleptic malignant syndrome. There are multiple drug-drug interactions, So instruct the client to notify their provider when starting a new med. Now, among the many meds that can affection of antipsychotics are anti-ulcer medications, anticonvulsants, lithium, fluoxetine, and antacids. Teach your client that cigarettes, caffeine, and alcohol can also interfere with the action of antipsychotics. Finally, help your client to adjust to the anticholinergic side effects. Drink water or keep sugar-free hard candies for dry mouth. Increase dietary fiber to avoid constipation, and change positions slowly if experiencing orthostatic hypotension. Well, that's it for today. Stay safe.